Well, there is a sensitive subject that I'm sure a lot of women out there just don't like to talk about, yet it's a problem that affects many of us. If not you, then someone you know. According to recent research, 1 in 4 women suffer from excessive menstrual bleeding, extended, painful, heavy periods. But you don't have to suffer because there are options out there. And joining me now to discuss those options is Dr. Robert Rubino. Doctor, welcome to the show.
Thanks for having me.
You know, I find it really interesting because a lot of women don't like to talk about it. After the birth of each of my children, my periods got excessively more painful and more difficult to manage. But it's something that a lot of women suffer with in silence. Why is that?
Well, sure. I think part of the problem is some women don't know that they're having heavy periods. And some of the signs and symptoms may be bleeding for 7 days or longer, or clots with your periods, or just feeling tired and wiped out during your menstrual cycle. Excessive has been redefined by the American College of OB/GYN recently as to any bleeding, menstrual bleeding that is disruptive to the patient's life, which really was, I think, a boon for women, because now they can define it not by an amount, but how they feel or how it interferes with their daily functioning.
So you don't necessarily have to quantify the amount and saying, you know, it's a half cup, because who knows what that is. But if it's something that you recognize is more than normal, then there could be an issue there, or could be a problem there.
Sure. If you're spending a lot of money on feminine products,
sure,
if you're getting up in the middle of the night or not attending to your daily activities because you're bleeding, that's enough.
All right. So what causes abnormal uterine bleeding?
Well, certain conditions such as fibroids, which are little growths inside the uterus, sometimes medications or blood thinners, and sometimes overgrowth of the uterus lining, which can be a precancerous condition. So it should be evaluated.
And so if you don't treat it, I mean, what are some of the risks with not treating excessive bleeding? What are some of the risks with suffering in silence?
Well, you could become significantly anemic, which can really affect your overall sense of well-being and your functioning. A precancerous condition actually can go undetected and progress to a cancerous condition. So it's very important. And the fibroid tumors can grow and become a problem if they're not evaluated. All
right. So what are some of the treatment options that are out there?
Well, traditionally it has been hormonal therapy, and then on the other end of the spectrum was hysterectomy. With
That's
ablation.
Like one extreme or
sure.
the other.
And ablation is a nice intermediate tool, and there's 2 types of ablations. Ablations are basically where you destroy the uterus lining to get rid of the period altogether to make it very light. There's hot ablation and cold ablation. Hot ablation is kind of painful and has to be done under general anesthesia. Cold ablation, or her option cryoablation, is what we're talking about. That's done in the office, and the ice is a natural anesthetic, so it's almost no pain in some cases, and in most cases very little pain. We take a little slender probe, it looks like a pencil, and it creates an ice ball on the tip of it. And we place that pencil inside the uterus cavity, and we freeze the lining of the uterus, and it eventually just sloughs off, and the bleeding either stops or gets very much diminished. And it's essentially an office visit that we do it in, and the patients get up and walk out.
Anesthesia? No?
There's really no anesthesia necessary. I do give a little bit of a Motrin type of drug beforehand. Some patients don't even want that, but it only takes about 12 minutes to do, and we do it directly under ultrasound guidance, so we're able to watch what we're doing the whole time. In the old days, any procedure that was done in the uterus was often done blindly, and this procedure is nice because it's safe, it's rather quick, and it's relatively painless. So it's been a real boon for my patients and a lot of patients nationally. I probably do 90% less hysterectomies now because of this technology, and it's done 15 minutes in the office. It's a really great treatment.
Well, you know, I was going to ask you what are the benefits, but I guess the benefits are that you're doing far fewer hysterectomies, and women are experiencing less pain, because this seems to be less invasive, right?
Oh, certainly. I mean, it really is basically an office visit for an office procedure. One of my patients, as a matter of fact, about 3 hours after I did the procedure, I bumped into her outside of a restaurant smoking a cigarette. So, of course, I said to her, that's not what I meant by resuming normal activities. But it was very heartening to me that this woman can go back to her normal activities and go out to dinner 3 hours after leaving the office.
Amazing, because you know what? We actually talked to a lot of women who had this procedure, and they say this procedure has really changed their lives for the better. So let's take a listen.
My cycle before the her option procedure was typically about 7 to 10 days of really, really heavy flow. It meant that I couldn't leave the house, I couldn't be with my kids, and I couldn't go about my daily activities. The 2 things that really sold me on the her option procedure were the ease of the procedure itself and the short recovery time. There was really minimal discomfort, very similar to an annual exam, and I went home without any pain medication.
Life after the her option procedure has been a big smile for me in an everyday life.
Since I've had the procedure, things are great, excellent. I don't have to worry about the heavy bleeding, the embarrassing moments.
I can feel free to wear whatever I want.
I'm free all the time. I don't live by calendar anymore, counting every 28 days.
It's been a big plus for me.
I'm really just the envy of all my friends right now. This was the best thing I've ever done.
You know what? Those patients seemed really, really pleased with the results from this. But is this right for everybody?
No, it's not right for everybody, and that's why, as I said, the beginning of our talk is that you have to diagnose what the problem is, because sometimes precancerous conditions can be at play, and you really have to diagnose why a woman's having heavy bleeding before you treat. But the vast majority of women who do have heavy bleeding that's not due to some precancerous condition are candidates for this, as long as they're done having their children.
All right, Dr. Rubino, great information and great advice to a lot of women out there who are suffering from this. Thank you for being with us this morning on the Balancing Act. And to find out more information on this non-invasive procedure for reducing excessive bleeding, we want you to check out heroption.com. Lots of great info on the website, and the link is at the bottom of your screen.